So this is the second session wherein we look at the vulnerabilities and constraints built into algorithmic system, emphasizing that AI is not flawless or neutral decision maker. Every algorithm reflects the data it was trained on. Again, let's go back to the first lecture that I did. I told you AI should be what? Taught or trained? How do you train your AI? Neo, yes, give them books to read, but make sure your AI won't go against you. Remember those movie, I, Robot, Terminator, right? Those are the AI going against you. Every algorithm reflects the data it was trained on, the assumption embedded in its design, and the limitation of the human who creates and uses it. This factor shapes how digital tools interpret information, what patterns they detect, and where they are most likely to make mistakes. A major focus of the discussion is the role of cognitive bias or cognitive biases, the mental shortcut and blind spot that influence human judgment. These biases don't disappear when we use AI. Instead, they often become intertwined with algorithmic processes. Clinicians may overtrust algorithmic output, misinterpret predictions, or fail to notice when a model is operating outside its intended context. In this way, human cognition and algorithmic logic can amplify each other's weakness. So, this will unpack how predictive models actually work, how they learn from data, and how they generalize patterns, and why they sometimes fail when exposed to new population, rare events, or shifting clinical environment. So, under this failure condition is essential because errors in digital medicine can have real consequences for patient safety and equity. So, by exploring this interaction between human and machine decision making, the session highlights the ethical and governance issues and challenges that arise in digital healthcare. And issues such as transparency, accountability, fairness, and privacy and regulatory oversight become central to ensuring that AI tools are used responsibly. Through this examination, students gain a clearer understanding of the risk, responsibilities, and safeguard required to support safe and accountable AI use in clinical settings by the end of the lecture. And they should have a deeper appreciation of the complexity involving in managing AI enabled healthcare environments and the framework needed to guide their responsible implementation. So we'll discuss the algorithm, the biases, and cognitive limits. So these are my contents, outlines the map, the essential dimension of algorithmic practices in healthcare by moving from the technical foundation of AI system to the broader ethical and governance issues that shape their real-world use. It begins by examining the inherent limitations of computational model, limitations that arise from the data they are trained on, the assumption embedded in their design, and statistical boundaries that define their performance. This first step establishes a realistic understanding of what algorithm can and cannot do, grounding the discussion in practical constraints that influence accuracy, generalizability, and reliability. building on the foundation, the session then turns on the challenges and explainability and the complexities of human AI interaction. Even when algorithms perform well, their internal logic can be opaque, making it difficult for clinicians to understand how predictions are generated or when they should be questioned. At the same time, human cognitive biases, such as what is the most common human cognitive biases in AI? Let's see. Yes, Mele. What's the answer? Api Salome, what's the answer? Neo, what's the most common human cognitive bias? Vicenta, Noela, Chris is covering his face, so I won't recognize him. Again, what do you mean by cognitive bias? Yes, so what is the most common in using AI? Okay, I have a question. I have a question for you guys. Raise your hand first. Everyone, raise your hands. No, one hand only, not hand. One. Mary, one hand. Okay. Bring down your hand if you use AI around 8 hours a day. You use AI 8 hours a day or more? Less. Around 3 hours a day. 1 hour a day. Bring down your hand if you use AI 1 hour a day. So all of you use AI 1 hour a day. 3 hours a day. Okay, raise your hands again. Raise your hand if you ask AI what I should be eating for dinner or lunch. So all of you are asking AI like that? Yes or no? No. Who asked AI like that? Okay. No. Honestly, raise your hand. Wait. Raise your hand. If you ask AI what I should be doing today, raise your hand. If you ask AI, can you give me a timetable of what I should do? Raise your hand if you always ask AI what should no, you ask AI what you want to do, what you need to do, even the part that what I need to do. Anyone? But you know that there are a lot of people doing that. There was a kid, or there was something I saw in TikTok. Uh, one was proposing, but when he was proposing, he was using ChatGPT. And the one being proposed, the female, was using also ChatGPT. Then it came to the ChatGPT. I'm sorry, you have used all your. You should go back after 24 hours. The problem with human cognitive bias is what? Wow, we're near. The problem with human cognitive bias is what? I guess they over rely because they want to find the answer. And then frankly, the problem with human cognitive bias is they want to have a very easy life. If you have an easy life, you won't survive the real world. Remember that. This is the reason why chicks, words, needs to go out from an enclosed shell of egg, right? They need to push their strength. You understood what I'm saying? This is the reason why you need to pass through a very small hole to be to live in this world. You know what I meant, right? Even if you are in, even if you are in a cesarean, we need to pass on such hole. And then, what's this slice the whole uterus just for you to come out? Am I right? You need to have the hardship in order for you to learn what's the real life in the outside world, not the virtual. Most people want to stay in the virtual world. The question will now lie, can you keep the virtual full? And you become full, right? So these are my contents. And these are my objectives. By the end of the lecture, I hope. Let's start. Limits of algorithm and predictive models. So algorithms are fundamentally limited by the data used to build them. If the training data are incomplete, low quality, or collected from a population that does not reflect the real world, settings where the model will be deployed, the algorithm will inevitably produce distorted or unreliable outputs. Biases embedded in the datasets for demographic, socioeconomic, geographic, or clinical are learned and amplified by the model, leading to systematic errors that disproportionately affects certain groups. Even well-designed models can fail when applied in contexts that differ from their training environment, such as new clinical workflows, different sensor types, or unfamiliar patient characteristics. So beyond this limitation, also models also deteriorate over time. As population evolve, disease patterns shift, clinical practice change, and environmental exposure fluctuates. The statistical relationship the model once relied on become less accurate. This gradual loss of performance is known as the model drift. And it can occur silently unless systems are actively monitored, recalibrated, and retrained. We go back to the first lecture, right? I told you machine learning needs to be recalibrated, retrained, and monitored. Without continuous oversight, even high-performing algorithm can become unsafe or misleading, underscoring the need for robust governance, validation, and lifecycle management in digital health. So many high-performing models, particularly deep learning systems, operate as black boxes, meaning their internal decision-making processes are not easily interpretable by humans. This model may analyze thousands of variables and nonlinear interaction that even expert clinician cannot trace or verify. As a result, when an algorithm produces a recommendation, clinician may be unable to determine why it reached that conclusion, whether the reasoning is clinically sound or whether hidden biases influence the output. This lacks transparency, undermines trust, complicates accountability, or show clinical adoption, especially in high stakes environment, where decision must be justified. Explainability tools such as saliency maps, features important rankings, and surrogate models attempt to make this system more interpretable. However, these tools often provide only partial approximate explanation. They simplify or abstract away the true complexity of underlying models, sometimes creating a false sense of understanding. In some cases, explainability method highlights correlation rather than causal reasoning, or they fail to reveal deeper structural biases embedded in the data. Thus, while explainability tools are valuable, they cannot fully resolve the opacity inherent in many advanced AI systems, reinforcing the need for careful validation, governance, and human oversight. So AI can enhance clinical decision making by offering rapid analysis, pattern recognition, and real-time support. But it can never substitute for the human relationship that lies at the heart of medical practice. What does it mean? Let's make it let's make an example. I have a patient here who has cancer. If I'm a machine, you'll die in 6 months. Right? You'll die in 6 months. Blunt, no human feeling that what will that person feel. Am I right? But if the doctor is a human, how would you say it? Based on the result, you have a 6 month survival rate. But this doesn't mean that you will really die in 6 months. There are some percentage that you can still, but it's a low percentage. Will you get that treatment or not? We can still prolong your life, but the treatment won't be good. Can I be excused? Where are we? Yes, that's the human factor. That's why I told you doctors cannot be replaced by AI because of the human factors. Because you have that humane feeling, the one that coming from the heart. That what will this patient feel if you tell it bluntly? So patients rely on clinicians not only for diagnostic accuracy, but also for empathy, reassurance, and the nuance interpretation of their lived experience. As I mentioned a while ago, elements no algorithm can replicate. When clinicians lean too heavily on automated recommendation, this is now what? You rely in AI. There is a risk that their own clinical reasoning becomes passive or undeveloped, leading to automation bias where the machine's output is accepted without sufficient scrutiny. What does it mean? It means that what does it mean? If you rely to almost in AI, sooner or later, you cannot think if there's no more AI. Because you're not, uh, I'll give you an example. Sports. Let's go to the example of chess. Those people who are grandmaster, why are they good in chess? Because they eat more than 3 hours practice, and sometimes what I see before eating breakfast, they play a game of chess for an hour. After breakfast, they play again chess. In short, they are what? Enhancing their skills. But if your skill is AI and you are asked, sooner or later, if you are not with an AI and you are asked, you cannot think. Am I right? Especially if you ask AI, what can I eat for breakfast today? Those simple matters. So this can erode clinical judgment, as I mentioned a while ago, diminish situational awareness, and ultimately compromise patient safety. Over-reliance on AI can also weaken the therapeutic alliance. Patient may feel dismissed, depersonalized, or reduced to data points if they sense that decisions are being driven by algorithm rather than by a clinician who understands their values, fears, and context. Trust, a foundational component of care here, depends on the patient's belief that the clinician is fully engaged, attentive, and accountable. So to use AI responsibly, clinician must integrate algorithmic insight with human skills, empathy, communication, ethical reason, and contextual understanding. This means questioning AI outputs, interpreting them within the patient's unique circumstances, and ensuring that technology augments rather than replaces the clinician role as a compassionate, thoughtful decision maker, not only asking a machine, what is my, what's that? What is my judgment for this patient? So digital tool can amplify human cognitive biases in subtle but powerful ways, often without clinicians realizing it. When an AI system presents a clean, confident output, it can create a false sense of certainty that overrides a clinician's natural skepticism. And what is those? One is overconfidence bias. Emerges when clinicians assume that the algorithm recommendation must be correct simply because it is generated by a advanced system. To tell you frankly, for me, the more advanced system is still the human brain. A machine can only work what you have programmed to them. But the human brain can do what? Can do other tasks just by interpreting the basics. So this leads to uncritical acceptance of output, even when they contradict clinician, institution, or patient-specific context. Next, bias. Digital omnipotence bias goes a step further. It creates an illusion that algorithms are inherently superior to human judgment. Ah, the people outside. Because AI system process vast amount of data and use complex mathematical models, Clinician may unconsciously believe that the machine sees more and knows better, even when the model is trained on incomplete bias or outdated data. This misplaced faith can mask errors of obscure the limitation of the technology. The law of least effort also plays a major role. What does it mean? You just input it, then you get your answer. The problem is, remember, there's a disclaimer underneath all the machine learnings. And what's that? We can commit mistakes also. Digital tools make it easy to rely on automated suggestion, reducing on cognitive load on clinician. While this can improve efficiency, it can also encourage shortcuts. Clinicians may also defer to algorithm instead of engaging in deeper reason, cross-checking information and considering alternative diagnosis. Finally, meta-ignorance, not knowing what we don't know, becomes especially dangerous in digital environments. Clinicians may be unaware of hidden assumptions, data gaps, or algorithmic constraints that shapes AI output. Without understanding this blind spot, they may interpret results or overlook critical nuances. Together, these biases can distort clinical judgment, weaken critical thinking, and compromise patient safety. It's like what? Again, let's go back to that example. You lie in 6 months. And because the patient became depressed, he died less than 6 months. You know what's more difficult in a patient who's dying? You take out that hope. You take out that hope. Instead of prolonging them, you take out the hope. It will not be prolonged. Recognizing and mitigating them essentially for responsible balance and safe use of digital health technologies. So digital health relies on sensitive data, clinical records, physiological signals, behavioral patterns, geolocation traces, and even environmental exposure. Because these data streams are deeply personal and often continuous, they carry significant ethical, legal, and safety implication. Without proper safeguard, the same information that enables early detection, remote monitoring, and personalized care can also expose patients to privacy breaches, discrimination, or misuse by third party. Governance framework provide the structure needed to manage this risk. They define how data should be collected, stored, and transmitted, accessed, and eventually deleted. Effective governance ensures that data use is transparent, consent driven, and aligned with ethical and regulatory standards. It also clarifies roles and responsibility. Who owns the data? Who can modify it? Who can share it? And under what conditions? This framework help maintains accountability across the entire digital health ecosystem, from devices, manufacturers, to clinicians, to cloud service providers. Cybersecurity threats add another layer of complexity. The ransomware attack, device hacking data interception, and unauthorized access can disrupt care after clinical data or expose sensitive patient information in extreme cases. Compromised device such as insulin pumps or cardiac monitor can pose directly physical risks such as breaches in code, patient trust, undermine clinical confidence, and can have a long lasting institutional consequence. So, for this reason, strong governance and robust security practices are not optional, they are foundational. Encryption, authentication, protocols, audit trails, redundancy system, and continuous monitoring must be built into every layer of digital health infrastructure. And equally important is cultivating a culture of digital responsibility among clinicians. Administrators and patients only with comprehensive governance and vigilant cybersecurity can digital health system remain safe, trustworthy, and resilient. Ethical and legal consideration determine not only whether digital system can be deployed in healthcare but how they must be designed, monitored, and governed to protect patients and clinicians. Actually, now in every AI, they are trying to formulate number one, the ethical use of AI. Number two, what do they need? So when AI tools influence diagnosis, triage, and or treatment, questions of liability becomes unavoidable. Who is responsible when an algorithm makes an incorrect recommendation? Is the clinician who used it, the institution that deployed it, or the company that built it? So who is responsible if there's something wrong with the algorithm? Everyone here has a phone and iPhone, or even laptops. Does everyone here has a phone, iPhone, or laptops? Yes. Have you noticed your phone, your iPhone, or even your laptop is always asking to update its database, right? That's the thing. For me, clinician who use it should be responsible because they know the risk of using an AI in the hospital. So these uncertainties create real tension in clinical practice and highlights the need for clear accountability framework. What happened to the aircon? I don't feel cold. Is it cold? No, it's hot. No. Yes, we can lower this because the air is not going to you all. You understood? Ah. So bias and fairness are equally critical. If an algorithm is trained on data that underrepresent certain population, this is what I meant. That's why you need to train your AI always. It may systematically misclassify, undertreat, or overlook this group. Such harms are not theoretical, but they have been documented in risk scoring tools. Dermatology algorithm and pulse oximetry device ensuring fairness requires rigorous validation across diverse population, continuous monitoring for drift and transparent reporting of model limitation. So regulatory bodies plays a central role in reshaping safe development. Regulations require transparency about how does model work, what data they use, and how they perform across different groups. They also mandate auditability, the ability to trace decisions, detect error, and investigate failure. Responsible use frameworks emphasize human oversight, informed consent, data protection, and clear communication about what AI can and cannot do. Together, this ethical and safe legal safeguard ensure that digital system enhance care without compromising patients' right, clinician judgment, or public trust. Any questions? Do you understand what we were talking about? Did you understand or no? Again? It's just I'm telling you that don't rely much on AI. You still need to use what? Yes. This is the most powerful AI. Did you know that? Your higher function is the most powerful AI. Do you agree? Where is your higher function? Where is my higher function? No, my wife. Guys, just remember this. Your higher function when you're married is your wife now. Do you agree, girls? You agree? No. Someone is saying no because of what? That's the summary. Use your brain. Do not rely on AI. Agree? Do you agree with this quote about AI? Do you know who's the protagonist in this movie? What's the name? No, I'm asking what's the name of the protagonist. I'm not asking the name of the actor. No, Morpheus is not the protagonist. Do you know the name of the protagonist? Who? Ah, tell them. Neo is the protagonist of the movie. If you see those quotes, there's a reason why I put those quotes. Again, this is our my reference.